Good morning. I'm addressing you today as the president of the Monroe County Council of School Superintendents, along with Kathy Grotman, vice president of the council and superintendent of the Greece schools. As school district leaders, we want to join our health officials and county leaders in sharing accurate information with you regarding the coronavirus and its impact on our schools. We continue to take the health and safety of our students and staff members very seriously and want to assure our communities that we are prepared. Our preparation includes working hand in hand with the Monroe County Department of Health, the State Education Department, and the CDC in following their guidance. As this is a public health crisis, it is important that we follow the leadership of our health experts, focus on the facts, and continue to dispel rumors. Yesterday, news broke of the first confirmed case of coronavirus in our county. While we understand that this can raise people's anxiety, it is important to note that this individual traveled to a high-risk country and did not contract the virus locally. The risk to our communities remains low. We continue to work with the Department of Health and the State Education Department as we evaluate all scenarios in which we might need to close. Should this become necessary, we will share further information. While there are no definitive plans to close school at this time, we recommend that families begin preparing for child care in case closures become a reality. At the same time, it is incumbent upon us to begin taking additional precautions to prevent the potential spread of this virus to our area. With that in mind, county superintendents have been discussing the situation daily and working collaboratively on common preventative measures, such as canceling travel and group activities and events that involve more than 50 people. Some districts, including ours, have also put restrictions on outside visitors to our schools. We are continuing our previously established practices, including enhanced cleaning and disinfecting of classrooms, high-traffic areas, desks, light switches, restrooms, as well as our school buses. We are also continuing to emphasize hand washing and respiratory etiquette to our employees and students. The best method of prevention continues to be washing hands with soap and water for at least 20 seconds and using alcohol-based hand sanitizers. In addition to these measures, we want to emphasize that it's extremely important for students and staff members to stay home if they are sick. Our protocol has always been that students or staff members who are ill should not return to school until they have been fever-free for at least 24 hours. If the time comes when we have a confirmed case of coronavirus in one of our districts, the State Education Department has indicated that we must close school for at least 24 hours. The purpose of this closure is to determine who the individual has been in contact with, ensure that the building is thoroughly cleaned and disinfected, and to allow the Department of Health to provide us with further guidance and next steps. The coronavirus outbreak continues to evolve and change on a daily basis. We are working diligently to stay informed and share information with our communities on a regular basis. The best way to combat fear is with facts. We ask that our parents stay informed by visiting reliable sources such as the CDC and the New York State Department of Health websites, as well as the websites our districts have created to keep our communities informed of our specific actions. Finally, we want to thank the Monroe County Department of Health for their ongoing guidance and support. We also want to thank our families and staff for their cooperation and support as we continue to navigate this situation together. And I'll take some questions at this time.
So going back to yesterday's press conference, the Monroe County Public Health Commissioner, Dr. Michael Mendoza, really urged people to avoid situations 50 people or less. You said that coronavirus, well, you'll address it once it comes, but looking at the way that this has been spreading throughout the world, why did you make this decision if there's hundreds of people in these school buildings? Don't you see that as a threat?
Ultimately, the decision around the medical advice comes from our Department of Health, and we're waiting guidance and working with them daily. Ultimately, when we look at canceling things with more than 50 people, it's the decision on whether it's a social event or something that's necessary. Education is a necessary part of our society, but again, we're working with the Department of Health on when or if our schools close.
So are you saying education more important than public health?
No. Education is compared to education in social events, which is why we're canceling dances and travel and field trips, things that are not necessities. Our schools take the health and safety of our students critically important, students and staff, and that's why we work very closely. It is a health issue, and we will take our direction from the Department of Health when and if we need to close.
Do you have any idea how many students are absent today, maybe whose parents decide?
I don't know how many students are absent today.
Sure. Do you suspect that it could be more than usual?
I imagine that we probably have more students out absent today, in part due to people being concerned about coronavirus.
How prepared are local schools in general when it comes to the ability, if it got to that point, to maybe do online schooling, that sort of thing?
We are all looking now and planning for what we will do if schools are closed. Is working towards that at the moment.
Tom, yesterday the county health director strongly encouraged people to avoid gatherings of 50 people or more.
Correct.
Which may not be a classroom, could be your hallway though.
Mm.
How do you reconcile the fact that you're keeping schools open with that recommendation?
Sure. The decision to keep schools open really falls, because it's a health issue, with the Department of Health, and we're taking that guidance. We continue to do hand washing. We have Purell or hand sanitizer throughout all of our buildings and classrooms, and we're working with social distancing as much as we can in those larger areas.
Did the county health department or the director of public health give you any direct advice? And if so, what was that?
Continue to really follow the Department of Health website and the CDC information. And again, the Monroe County Department of Health has been incredible to work with. We are working with them, started daily, and now I would tell you multiple times a day in conversations and consultation with next steps.
What
You
happens
said
to-
different schools have different capabilities when it comes to online learning. So are there certain schools that are having concerns that may not be able to deliver if their school had to close? Are there any schools in that situation?
This area that we're in now is really unprecedented in terms of long-term closure or the possibility of long-term closure. Every district is going to find a way to support instruction when schools or if schools close.
And do you know anything about how long they would have to close, depending on if there was a case in the school or anything like that?
We would immediately be working and are working with the Department of Health in terms of length of closure if it happens.
Kathleen, your district is one where a lot of kids rely on getting 2 meals a day. Can you talk about, in your district and elsewhere in the county, if you know about the planning in terms of food distribution and that
Yep.
eventuality?
We're all planning for that. So while some districts are needier, every district is working on a plan to provide breakfast and lunch to students who need it. So for us, that becomes kind of, I don't want to say easy, but we provide meals for students all summer, so we're going to be using a similar model in Greece. I know some of the other districts will use that as well. And then the other piece that is important is we've been partnering with some of our agencies like FoodLink, community agencies that have been wonderful in terms of sort of thinking and planning. So beyond breakfast and lunch, what else might we be able to do for families?
How would that play out, just logistically, as far as if a school building was closed?
So if a school building was closed, we would, and shut down, according to our guidance, they shut down for 24 hours. There's a deep disinfectant. The building is cleaned. And then we would potentially use that building as a site for meals. So bring cafeteria staff in. They would help students. The way our program would work, and again, this could be different depending on the district. Students under 18, anybody under 18 could come in, pick up breakfast or lunch.
What about those workers who would be cleaning those schools? Any thoughts about them?
I could say. So again, we're working with every district's a little different. We're all working with our staff in terms of cleaning and what that would look like if we have to close.
So I can name at least one student off the top of my head that I know specifically in the Monroe County school system that has a very weak immune system. How does that student still get the ability to learn in a proper manner and still get set up for success? Are you doing any special guidelines? Are there any home tutorings that you're setting up because that person is more susceptible?
Sure. Across the county, we know in our schools and our communities we have people who, for a number of reasons, may have a weakened autoimmune system. we're working as we would any time during the year with those families with medical recommendations on why a student may need to stay home. We're working to provide work with teachers, and do whatever we can to support those situations where a student may have a weakened autoimmune system.
So what
Tom,
are some
both your
examples?
district and Kathleen, your district had students travel to Europe, Italy, and came back in earlier and attended school. There's concern with parents who are contacting us about how those children ended up back in the classroom. How do you allay their concerns?
There were a number of districts that had travel over February break to places like Europe. And at that time, we all worked closely with the Department of Health. The guidance at that time was that there was not a mandatory quarantine. And so we followed Department of Health at that time. They monitored symptoms, and if there was a concern, then it would be addressed. At this point in time, there are no confirmed cases of coronavirus in any of our schools, and we follow Department of Health guidance for that and for everything else.
Is there a concern now, knowing what you know now?
I think this is changing every day, so I can tell you that we're always concerned about the health and safety of our students and staff, and we're taking this very seriously and working very closely with the Monroe County Department of Health, but we're also staying focused on how do we plan and support our students every day, including if there were to be a closure.
Kathleen, can you answer that question as well?
In terms of my
Grace,
concern?
yeah.
I would echo exactly what Tom just said.
How are BOCES 1 and 2 stepping in, and whether it's for distance learning or anything else?
So BOCES 1 and 2 have been incredibly supportive. The Monroe County superintendents work very closely together, and so they're continuing to provide guidance from Albany. They're typically our direct contact to state education, and they are offering a great deal of information and support during this time.
Can you give us specific protocols that you are taking when it comes to the plans? Are you doing more cleanings throughout the school? Are you making sure that contact is limited in gym class? And a second question to that, how are you handling the sports teams?
Sure, so absolutely to focus on cleaning schools. All of our schools are cleaned and disinfected on a regular basis anyway, but when issues like coronavirus come up, we really make sure that we step up protocols and do some deeper cleaning in high traffic areas. In regards to athletic, I do not have anything to announce now for a plan. As you know, the State Athletic Association is making some changes, and that is one of the conversations ongoing now in Monroe County on local districts and what that might look like, especially if there were to be a school closure.
So back to the online classes, what are the districts planning for kids who may not have online access at home if that were to happen?
Sure, so every district is different when it comes to online computers at home as well as internet access, and it really is going to be a district by district rollout on plans if there were a closure. And so I would just really encourage parents to make sure that their emails are correct in their school system databases, so that when we share information out as individual districts, they'll have that information that'll be specific to their district around instruction.
Does this have any impact on testing coming up, SATs and things of that nature?
So as of right now, SATs through the College Board is not a district decision. They are still running SATs in most school districts that host them, with a lot of different changes. They're allowing for students to wear masks and gloves, which would not be permitted during a regular SAT test, and they're also mandating seats further apart than typical. When it comes to state testing, we're awaiting guidance from New York State Education Department.
The City School Board yesterday said it's going to have no visitors at its meetings going forward. Is that something that other districts are going to put in place?
That is going to be an individual district decision. I have no overview right now on what each district's going to do with visitors at board meetings.
What about your district?
We don't usually get 50. But no, it's a district by district decision.
Hey, Tom and Kathleen, are there any students, staff, or faculty that are currently under quarantine?
I can't speak to that because I'm not sure. I can speak to my district. There are a number of people in our community, in our county, out of all physicians, out of abundance of caution, I'm sure are asking people to stay home and self-quarantine in some situations. I don't know of anybody specifically in that case, but it's possible, whether it's in school or outside of school. People are taking this very seriously.
Any of your students, faculty, or staff being quarantined?
Not that I can speak of, no.
Kathleen?
Going to
Kathleen,
that,
hold on a second. Kathleen, any students, faculty, or staff in Greece quarantined?
I know of one faculty member, not a teacher, who has self-quarantined. And I will say that that was clearly out of abundance of care, and I'm quite frankly not concerned, and I don't think he's concerned. I think it's more just out of an abundance of concern.
I think the biggest piece to remember is that as of right now, at this time, there's no confirmed cases in any of our school districts for staff or students. As we know, this is changing hourly, and things could be updated, but at this point, while there may be some people in quarantine, it's possible that there are no confirmed cases of coronavirus for students or staff at this time.
I know you said you're going to follow kind of the lead of the Department of Health here and State Ed Department if a case does pop up, but let's say if one case does pop up in the school districts around the county, would that be grounds for all schools to close temporarily, or would you go on a case-by-case basis?
It would really be a discussion with the medical experts at the Department of Health. That is where we would lean. We're instructional and school experts. When it comes to health, we're going to turn and look and get guidance from the Department of Health.
In your discussions with the Department of Health, have you talked about what it would take to reopen a school should it close?
That is a question on if schools close, when would they be reopened? And that would be a situation that we would have to discuss with the Department of Health. There's no plans now that if there was a closure, how long it would last.
Have you spoken with anybody about funding issues? Even putting aside if you close, what that would look like, but up until now, the extra costs that have been incurred, is that a budget concern? Do you think you can get money back from that for anything?
Right now, I'll tell you where we are with the health crisis of coronavirus is we're focused on health and safety. Budget conversations take a second seat. I'm sure we'll have those conversations, but right now it's what is the best thing to do, working with the guidance from the Department of Health on health and safety of our staff and students.
How involved has the Monroe County Health Department made you with every single case? I mean, because you look at kids, they spread the common cold very easily, and it goes really quick through schools. You know, this is still flu season. How involved have you been with now coronavirus?
The Department of Health has been very supportive. I can't thank them enough for the work they've done in terms of updating us and keeping us in the loop with best practices. So I just cannot speak highly enough about the relationship the Monroe County Department of Health has with school superintendents.
Parents who may be watching it. Oh, yeah, go ahead, Tim.
What message do you have for parents who might not be confident sending their kids to any school that they go through the county?
Yeah, it's this time is a bit unprecedented. It's I understand it causes anxiety. I just can't stress enough that make sure that you're looking at the most reliable sources, the Department of Health website, the CDC website for your information. Try to, I know social media is there and everybody shares things, but we really encourage people all the time, but especially during an issue like this, to make sure that you are staying calm, focusing on facts, doing everything you can to be preventative, hand washing, etiquette with coughs and sneezes. And I would just encourage parents to continue monitoring information from their district, that if there were a closure, now is a time in any emergency situation to have a plan for childcare. As educators, that obviously is one of our #1 concerns. Many of our students need childcare if they're not in school, so it's imperative that parents at least have a plan for an emergency such as a long-term closure.
What about buses? How are you cleaning those?
Sure, all of our, we clean buses, but during this time, we've really stepped up and enhanced. We're really disinfecting. Districts are doing different things, but including disinfectant wipes and sprays and different products that clean buses, the seats, and we're doing that now on a daily basis to make sure that our buses are not just clean, but disinfected.
After every ride? I mean, I know that some buses go throughout the entire district, so they'll go from, Greece to Penfield, but how does that work?
So right now, it really is district by district, but most of us are trying to clean buses throughout the day and at the end of the day.
Besides assemblies, have you been really instructing kids about food sharing or when it comes to lunch? I mean, again, going back, this is still flu season, so
yes.
Of course there's other threats out there when it comes to sicknesses. Besides assemblies, besides events, any other thing in school when it comes to these students to really making sure they're informed?
Yeah, remember K-12, we have some of our youngest citizens here coming to our schools. So I know that across many of our districts, we're doing hand washing lessons. Nurses have been incredible supporting how to best wash hands, and then many of our elementary teachers are doing hand wash breaks and coming in and out of class using alcohol-based hand sanitizers. So we're always educating students beyond academics, healthy habits, and this is just a very strong reminder of keeping all of our students and staff healthy.
I know for the general public, those supplies are kind of hard to get. How are you guys doing in the schools?
So in schools, we buy typically off a state bid in bulk. So we have a lot of toilet paper. So we're pretty good at supplies now district-wide across. Hand sanitizer, cleaning items, they really are bought in a large bulk for a school year. So the fact that it's still just briefly after the middle of the school year, districts are in a pretty good spot when it comes to cleaning supplies.
Have any districts put anything in place for their own employees who might have child care issues at home? Or have anything else that they can't come into work maybe, for instance?
We're working with every staff just like we always would if there's an issue about needing time off for specific reasons. So those are really individual personnel discussions, district to district.
Tom, I think people are going to, Tom, people are going to see SUNY schools closed. They're going to see colleges and universities closed.
Yeah.
They're going to see a number of things closed. And tonight they're going to learn that their schools are not closed.
Correct.
How does that make sense?
Well, I'll tell you that we're taking all of our guidance from the Department of Health. I will say that every school has a different impact. So closing a college level where they are all young adults is very different than closing a K-12 school where daycare, child care, and everything else comes into play. And so that's why I will tell you that we're working very closely with the guidance from the Monroe County Department of Health. We're planning for if we need to close, how that will look, and we're encouraging parents to make sure that they have an emergency plan for child care if schools do close.
So even though you said those would be different, closing colleges obviously different than closing public schools, but have you had any discussions with local colleges about kind of what they're going through since it was sudden for them as well?
I have not had any detailed conversations with colleges. Most colleges do have some form of online platform already created for instruction because they teach real classes and online classes, so we're a little bit different as a K-12 system.
You know, just when it comes to the doctors yesterday, I have to thank the teachers, the educators, and the administration for all they're doing to really make sure that, you know, in this decision, just going with the flow. But what happens if by tomorrow, less than 24 hours from now, there is another confirmed case that traces back to one of these schools? Parents are over the weekend. What is this whole plan set up? I know that the superintendents have been speaking, but what is the plan for those parents watching this right now? Are they going to get a text alert? How urgent is that going to be so they could plan childcare for Monday, the next day is following?
I would tell you that one of the things I'll encourage all families across the county is just to make sure that you have your email and phone number accurate in whatever system your school district uses. So if you typically get an email or a text message from the school, however that district communicates with you normally is how we're going to be communicating any sort of closure or shift in instruction.
Is there a specific like we got a hotline yesterday, is there any specific apps that people can really tune into?
There is no specific app or hotline for every school. We're all individual schools working together, trying to be consistent and work together as districts. So I can't encourage enough that every family wait for and listen for communication from the district their children attend.
And that could be over the weekend, let's just say even on a non-school day.
Yeah, we communicate now on non-school days as well. We communicate all the time with our families and our parents and our staff. And so, yes, communication on possible closure or anything else could happen at any time.
Tom, do you think that parents, as they're preparing for, let me start that again, as parents prepare, should there be a sense of urgency that this could happen Monday?
I think at this point it's fair to say we don't know. So I would prepare. I am a parent. I will prepare for child care starting on Monday in case that happens. We have no plans now to close, but I think it's important for any emergency situation to be ready for. And so yes, I would encourage parents to plan for child care as soon as Monday because you're better to be prepared than not prepared.
And just to be clear, what exactly has the health department told you about when you would close?
We don't have any specific information to share about if and when. Really what we are working on now is if and when.
Schools do close. Do you see extending school into summer?
That's a great question about extending school. We would be working with the New York State Department of Education on what the requirements would be if schools were to close for an extended period of time. That is one of the questions that superintendents are still working with the state on a specific answer to.
What's the process? What was the specific planning? Who sat down to make this decision that schools were going to stay open?
There's no sitting down to decide we're staying open. It's a conversation with the Department of Health on what their guidance is based on the medical expertise in the medical profession on what schools should do. And we await their recommendation and work with them.
So
I'll
who's-
take
who's
one
the
more
we?
question.
Who's the we in the council, though? Is it just?
School superintendents.
Every school superintendent?
The organization that Mr. Grotman and I represent is the Monroe County Council of School Superintendents, which is public superintendents in Monroe County.
Were there any superintendents that say no, schools should close?
No, we're all, I will tell you one thing, we're all in line with taking our recommendation from the medical experts from the Monroe County Department of Health.
So if
I'll
you
take
ask
one more
every
question.
superintendent, they're going to say, we chose to keep schools open in Monroe County?
Yeah, we're representing all superintendents today in Monroe County. I'll
Any
take one more
thoughts to
question.
change spring break dates?
There has been no discussion right now, no specific around changing spring break dates. Those have been set. At this point, I thank you for being here, and please make sure that parents are monitoring communication from their individual districts. Thank you.